Thank you. So without further delay, I would like to invite Ms. Trupti ma'am to introduce our first speaker, Dr. Sanmit Jindal sir.
Am I audible? Okay. Thank you, ma'am, to giving this opportunity to introducing sir. We are honored to welcome Dr. Sanmit Jindal, a clinical research fellow at the Houston Methodist DK Heart Vascular Center, USA. Dr. Jindal holds an MBBS degree from the Dayanand Medical College and Hospital and a Master of Public Health from the University of New Haven, where he also served as the President of Student Public Health Association. With extensive experience in cardiovascular research, clinical trials, and data analysis, Dr. Jindal has contributed to innovative studies aimed at the improving patient care and outcomes. His journey spans diverse roles from working as a medical officer with the Ministry of Health and Family Welfare Government of India to the research internship at the Harvard T.H. Chan School of Public Health and now contributing to cutting-edge advancement in the heart and vascular health in US. Today, he will sharing insights on the global career opportunities in patient care and clinical research, guiding young Pharm.D professionals to explore international avenues in clinical research and practices. Now, warmly welcome Dr. Sanmit Jindal to our seminar. Welcome, sir.
Hello.
Hello, sir.
Hello. Am I audible?
Yes, sir. Yes, sir. You're audible.
Hello. Hi. Good morning, everyone.
Sir, good morning,
first,
sir.
good morning. First of all, I would like to thank Vasantidevi Patil Institute of Pharmacy and Mr. K. Mallikarjun Reddy for giving me the opportunity to be here with all of you guys today. So first, I'll tell a little bit about myself. My name is Dr. Sanmit, and I'm a physician as well as a researcher. And I was trained as a medical doctor in India. And later I went to US to pursue my master's in public health. I did it from University of New Haven in Connecticut. During that time, I had the privilege of doing an internship at Harvard THN School of Public Health. And now I am working as a clinical research fellow in preventative cardiology at Houston Methodist Hospital, which is in Houston, in Texas. Now, although I am not a pharmacist myself, but I have had the privilege of working very closely with Pharm.D graduates. And I've done it in multiple settings. For example, I worked with them during my MPH, then during my research internship at Harvard, and now in Houston Methodist, where I'm working in preventive cardiology, I have a chance to work with Pharm.D graduates a lot. And what I have observed is that Pharm.D graduates are uniquely positioned because they bring a very deep knowledge about drugs, and they also have an ability to bridge care and research. So this is very important in today's healthcare world. There are very few professionals who can combine a strong grounding in basic science, and they have the ability to apply it in real-world clinical scenarios. Pharma graduates, in my experience, that gap very well. And they are not just medicine experts, they are patient advocates, communicators, and in recent world, increasingly they are leaders in multidisciplinary teams. During my MPH, many of my classmates were from pharmacy background. I still remember one colleague who came from India with a Pharm.D, and she was very focused on public health. And she began working on projects related to medication adherence in rural communities. And eventually, she transitioned into a research role. And another colleague from the same background joined a large pharmaceutical company in Boston, where he works in pharmacovigilance and monitoring drug safety. These were the people that I knew personally. And like their journeys taught me early on that Pharm.D training can open doors in both clinical as well as research careers globally. And like this isn't just about them moving into jobs. It was about how their Pharm.D background gave them transferable skills like understanding drug interactions, being systematic in their thinking, paying attention to patient safety, and writing in a very structured, evidence-based way. These skills allowed them to make the leap from classrooms in India to leadership in US research and industry settings. At Houston Methodist, I collaborate with pharmacy trained colleagues in research and outcomes work in cardiology, and they bring deep expertise in medications. But apart from that, they also contribute to study designs, data analysis, and implementation of projects. This dual ability to work in patient care system as well as in research is what makes PharmD training globally valuable. And I've noticed that they are often the bridge between physicians, statisticians, and patients. They are the ones who speak the language of science and the language of people at the same time. And I think that is a powerful role. So today, my perspective is that of someone who has observed and collaborated with pharma graduates in research, in public health, and as well as in direct patient care. And what I want to share with you is how your degree, if combined with proper preparation and the right skills, can take you into rewarding careers globally, especially in the United States. Can you go to the next slide?
Yes, sir. One second.
And the next. The next slide, please. Yeah. So why this talk matters? This conversation matters because this world is changing very rapidly, and so is the role of pharmacists. In many healthcare systems, pharmacists were once seen only as dispensers of medicines, but now their role has expanded into being decision makers, educators, researchers, and even like leaders in healthcare teams. And when you look at the evolution of pharmacy in the past 2 decades, you see a major shift. Earlier, the profession was often limited to only drug distribution. But
Yes, sir.
today, pharmacists are managing chronic diseases. They are advising on genetic testing. They are guiding public health interventions, and they're influencing policies. And this transformation is not just happening in one country. It is global, like it's happening everywhere. And globally, there is a rising demand for clinical pharmacists. Aging populations, increasing chronic diseases like diabetes and hypertension, and the growth of personalized medicine have made pharmacists essential to healthcare delivery. In the US, the role of pharmacy professionals is very structured, and there are clear pathways to advance in both patient care and research. This means that the demand for pharmacists is not just about filling positions, it's about solving real complex health challenges. And how do we reduce preventable hospitalizations due to medication errors? How do we ensure patients with chronic illnesses stay on therapy? How do we evaluate whether expensive new drugs are worth the cost? Like these are the questions where pharmacists are leading the conversation. And why is this important for you guys, everybody who joined today? Because as a Pharm.D aspirant in India, you are entering a field where your skills are not limited to one country. Your degree has the potential to be recognized worldwide, provided you understand the pathways, you understand the exams, and you understand the skills you need to build. So think of today's session not as me giving you information, but as me opening a window for you guys and showing you a landscape of opportunities that you may not have thought possible. And slide. So let's first talk about the clinical pathways in the US. So in US, there are three major settings where PharmDs work, and each of them comes with its own opportunities. So the first one is hospital and health or health system pharmacies. Here, the pharmacists are part of multidisciplinary teams in intensive care units, in cardiology wards, in oncology clinics, infectious disease units, etc., etc. And they are not in the background. They contribute expertise on therapy management, and they help in optimizing complex medication regimens. And they play an important role in ensuring that medication safety uh, is ensured at every stage of care. Then the second clinical opportunity is ambulatory care. This is a very upcoming thing. These are basically outpatient clinics, and they are mostly focused on chronic diseases like diabetes, hypertension. For instance, said diabetes management clinics are run by pharmacists, and they have shown great results in improving the blood sugar control, as well as reducing complications. Imagine being the professional who not only gives insulin, but also monitors the patients, adjusts the regimen, and then educate them on diet and lifestyle. Like that is the level of autonomy pharmacy graduates enjoy in ambulatory care. And it isn't just about diabetes. Ambulatory care pharmacists are now managing hypertension clinics, anticoagulation clinics, asthma clinics, and even lipid management programs. So these are the areas where pharmacists provide continuity of care, sometimes seeing the patient more frequently than the doctor does. And the third one is community pharmacy. So this role has also evolved significantly, especially after 2020, after the COVID pandemic. In the US, community pharmacists are now very central to the vaccination programs and medication therapy management, as well as chronic disease counseling. They are often the first point of contact for patients. And in many communities, especially rural areas, the pharmacist is the most accessible healthcare provider. So, to enter these roles, most graduates must pursue residency training. So, in PGY1, a PGY1 residency provides you with a broad exposure to different clinical areas, while PGY2 allows specialization. So, if you want to, then in PGY2, you can select in which specialization you want to go. You can go into cardiology, oncology, infectious diseases, and more. And after that, also some people like to pursue board certifications such as BCPS, BCOP, BCIDP, BCCP. So BC is basically board certified, and then, for example, BCCP is board certified clinical cardiology pharmacist. BCOP is board certified oncology pharmacist. So after your PGY2, you can go for these board certifications as well. So what these certifications do is they basically enhance your recognition and increase your career progression. Like I've seen people with how these credentials elevate a pharmacist from a general role into a specialist, like who is very highly respected within the medical team. And what's equally important is that these residencies and certifications give us signal to employers and colleagues that you are serious about your profession and you have invested extra time and training to bring this added value to patient care. Next slide. Now, these opportunities are not limited to hospitals and clinics only. Pharmacy professionals in the US are moving into entirely new areas, new frontiers. In many states, pharmacists now have authority to give prescriptions, but it is under collaborative practice agreements. And in these agreements, what happens is pharmacists are basically authorized to start a new therapy, or they can modify an existing therapy as well for specific conditions. But you have to be sure that you are under those practice agreements. And what this does is this expands the responsibility of pharmacists, and it positions them closer to the role of independent and individual practitioners. And another very new thing is precision medicine. So pharmacy professionals are leading pharmacogenomics clinics where the treatment is customized based on every patient's own genetic profile. And like this is the future of medicine. Like instead of one size fits all, therapies are tailored to individuals, and pharmacists are at the center of this innovation. Then there is digital health. It is another area where pharmacists are expanding their reach. So everybody's heard about telepharmacy. So where pharmacists provide consultations remotely. And it is really helping in bridging the healthcare gaps in rural areas. Digital therapeutics, where software and apps become a part of treatment, they also involve pharmacists in monitoring and guiding the patients towards betterment. And beyond this, pharmacists are also entering leadership roles in managed care organizations, insurance companies, and even health tech startups. Are like a lot of pharmacists are entering into health tech startups as well. And these are positions where they not only guide drug use, but they also shape the policies and like influence the entire system and how these systems are run. And finally, pharma grads are also increasingly integrated into chronic disease management teams. They sit alongside physicians, nurses, dietitians, and social workers, and they ensure that every aspect of medication use is optimized. And this shows that the future of pharmacy about leadership and decision making, and not just giving medications. Next slide. Yeah, so now I'll tell you about the research pathways in the US. So it is another major direction Pharm.D graduates can go for. In the US, like pharmacists are not only clinicians, but they are researchers as well. So they can go into academic medical centers where pharmacy graduates design and they run clinical trials. They also conduct outcomes research, and they publish in very good top journals. In fact, at my place, I work with a Pharm.D who is working as a clinical research coordinator, and she has contributed to a lot of cardiovascular outcome studies, and they are influencing how guidelines are written. So then you can go into industry as well, which is another huge opportunity. Like people with a background in pharmacy, they work in when they come here for masters, they do something. Later on, they have like better chances of getting into pharmaceutical and biotech companies. And they go into different roles such as medical affairs, regulatory science, pharmacovigilance, health economics. Some people I know have personally transitioned into industry now, and now they work with FDA regulatory team to evaluate the safety of new drugs, like which is very interesting. And research institutes also hire Pharm.Ds for projects when they are doing a drug development and they want to check the medication safety. And many people, what they do is after their Pharm.D, they come to US, they pursue public health pathways, they do an MPH, and later on they go do their PhD and move into roles like epidemiology or policy. And like some of my friends are working in WHO, and they're focusing on essential medicine policy right now. So you see, like research is not a side option; it's a full-fledged pathway where Pharm.Ds can make global contributions. And importantly, research experience often strengthens your candidacy for residency. So whenever, if you have a good research experience in early part of your career, and later on you think of going for residencies, fellowships, or even leadership roles, that will like really show that you have given your time into research for betterment of our medicine. And then it is both like research is in itself, it's a career, and or otherwise you can think it as a springboard to bigger opportunities. Next slide, please. So in this slide, I would like to tell you about the pathway, like how you can practice in US. This is a very structured licensing process, and the first step is credentialing. So the credentialing is, what is credentialing? They basically check um, like your degree matches the US standards or not. And it is done by NABP, which is the National Association of Boards of Pharmacy. And India's Pharm.D usually qualifies because it's a 5.5 years program, 6 years program. And this step may sound administrative, but it is the gatekeeper for everything else. It is also worth noting that this step can take time. So you have to keep that in mind. So what many many graduates do is they underestimate how long verification and documentation can take. So your transcripts, degree proofs, and attestations, they need to be collected carefully. If you miss any paperwork, this can delay the process by months. So planning ahead and being organized with documentation is very important. Once your credentialing is complete, the next hurdle is FPGEE, which is the Foreign Pharmacy Graduate Equivalency Exam. It is a rigorous test with 250 questions. They are multiple choice questions, and they cover topics like biomedical sciences, pharmaceutics, clinical sciences, and pharmacy law. And it is held only once a year, which means your preparation must be serious. Because if you lose this chance, you get another chance next year only. And along this, you must clear the TOEFL IBT with strict requirements. Especially, you have to get a speaking score of 26. So I've seen many bright students who underestimate TOEFL and then they face delays, which is why I emphasize start improving your English communication early on. And FPGE is like not just another exam. It is testing whether your knowledge aligns with US graduates or not. And it requires very deep understanding of not only pharmacology and therapeutics, but also pharmaceutical calculations, laws, systems. Like in many ways, it's a bridge. It's a way to bridge educational differences between countries. And after this, you receive the FPGC certificate, and you must complete about 1,500 internship hours under a licensed pharmacist. And this is the phase where you adapt to the US healthcare system. You learn the culture, you learn the teamwork, and as well as learn the workflow of American hospitals and pharmacies. These are not just a formality, they're a period where you build confidence, you learn documentation standards like electronic health records, you get comfortable with patient-centered communication, and many graduates say that this is the time when they really understand how the US healthcare system operates on the ground. After this comes the NAPLEX, which is the North American Pharmacist Licensure Exam. It is a 6-hour exam with 225 questions. But unlike many exams in India, it is not about memorization. It is case-based. For example, they might give you a scenario. For example, say a 65-year-old diabetic with kidney disease comes to you. Which medication adjustment is safest? So you must think clinically at that time as you would in real practice. So this means that preparation is not just about like memorizing the drug names. You have to start practicing problem solving. You have to start applying pharmacology to complex patients, and you should start thinking critically. Candidates who treat NAPLEX like application exam and not a recall test, they perform better every time. And Then there are some rules that change according to the states, and for that you have to give the MPJE, which is the multi-state pharmacy jurisprudence exam. It covers both federal and state-specific laws. So some states have their own law exams, but the principle is the same, that pharmacists must understand their legal responsibilities. This highlights another difference between US practice and other countries like ours. In US, pharmacists have high level of legal accountability. Their role is protected and regulated by law, and the pharmacists are expected to know that these laws very well. And finally, after you complete all these steps, you're done with your NAPLEX, you're done with your MPJ, internships are, then you can apply for your state license. At that point, you can practice as a pharmacist, you can pursue residencies, you can move into industry. This may take 2 to 3 years, but it is the most structured pathway. This is the first step, second step, third step. So this structured pathway ensures that every pharmacist in the US is highly qualified. It is a long journey, yes, but the clarity of the process is also its strength. Once you know the steps, you can plan, pace yourself, and then you can steadily move forward. Next slide, please. Now, this pathway sounds exciting, but it comes with its own challenges. So the first is the cost and length of the licensing process. Exams, applications, and internships, these are all very expensive and time consuming. So the solution is you should start planning early, start doing your budgeting, and start joining study groups, and you should have structured preparation courses. And when I say expensive, I mean that the combined cost of exams, preparation materials, application fees, and living expense during internship can add up to several $1,000s. And this is why financial planning is not optional. It is a strategy. Those who prepare early, save, and sometimes take part-time work while studying, they are able to move forward without like unnecessary stress. Then the second challenge is visa sponsorship. And like not every hospital or company can sponsor international candidates. So that's why some PharmDs enter US first through degrees like MPH or through PhD programs, or they start by working in research fellowships, and later on when they get their visa and or they transition to pharmacy practice. This can feel discouraging at first, but it also opens other doors for you. Like programs like MPH and PhD not only help with visas, but they also strengthen your resume. They make you more competitive for residencies. They make you more competitive for research roles. So while visa sponsorship is a barrier, it is also a chance to diversify your skills. Then residency is like, residency is another competitive step. Like thousands of people apply, but the spots are very limited. So what makes the candidate stand out? Do they have any prior research? The kind of externships they did? Very good, strong letter of recommendations. And like I cannot emphasize enough, if you want to pursue residency, start building your CV from now, as early as possible. And this is what I have experienced personally. The people who like, it doesn't matter the quality of your work in the early phases of your career, because in the early, everybody knows when you start you are learning, so the quality doesn't matter a lot, but eventually after years of practice you'll get a hold of it, and that makes you a very good candidate for any roles. So basically think about it like this: the application is process is not only about your grades, it is about showing that you are a well-rounded professional who can handle the pressures of clinical care and can contribute meaningfully to a team. Research, presentations, leadership activities, all these strengthen your application. Then another challenge is limited research exposure during PharmD training in India. But even here, like there are solutions. You can publish case reports. You can write systematic reviews. You can submit your paper, abstracts in conferences and go go and present there. These small steps strengthen your profile tremendously. And I want to stress that research does not always mean that you have to do big, large, expensive trials, very hardcore data analysis. Like even a well-written case report demonstrates that you have good analytical skills. A systematic review shows that you have the ability to synthesize literature. Like these experiences prove that you can think like a researcher, and they carry weight internationally a lot. Then finally, English communication is often a barrier. Many students are extremely knowledgeable, but struggle to express themselves clearly. So what is the solution? The solution is deliberate practice. May start a journal club in your college. Ask your friends to join journal clubs. Get some research papers. Start reading them aloud. Like start presenting papers written by somebody else. That way you will learn English as well as you will learn how to write. You will learn the methods, the way papers are structured. By starting a journal, you will have a lot of things that you can learn. Start presenting in English, write abstracts. I would suggest even use tools like Grammarly. And communication is not just for TOEFL, it is for every interview, every residency application, and every patient interaction. In fact, if you're moving globally, even your daily life, I would say. And I've personally seen like excellent students fall behind not because of knowledge gaps, but because they cannot present their ideas confidently in English. But the good news is that this is a skill you can practice every time you write, every time you present, or every time you explain a concept in English. You are preparing yourself for success in US. And like, what does the future look like? The role of Pharm.Ds will only grow. Can you go to the next slide? Yeah. So precision medicine, integrating genetics, artificial intelligence, all of these will need pharmacists to guide the therapies. Telepharmacy, digital therapeutics will become mainstream with pharmacists monitoring patients remotely. Chronic disease management will increasingly rely on multidisciplinary teams where pharmacists will play like leadership roles. And like it is not only about the US, the global healthcare system is shifting toward personalized care and digital delivery. So this means pharmacists with international exposure will be in high demand everywhere, whether in North America, Europe, Middle East, even in Asia. So think about where healthcare is heading: aging population, rising costs, new technologies. All of these create a need for professionals who can balance the cost, who can balance the safety and innovation. And people with a background with Pharm.D are very well positioned to be those professionals. So in short, Pharm.D degree, when combined with residency, MPH or PhD, they will produce healthcare leaders who are not limited by borders. The question is not whether there are opportunities. The question is whether you are prepared to take them. And next slide, please. Yeah, so let me end my slides with 4 key messages. First, your Pharm.D is a global passport. It is respected and valued worldwide. This means that with right preparation, you are not confined to only one country or one system. You can practice, you can research, you can lead internationally. Second, United States offers the most structured and rewarding pathway to combine patient care with research. Structured also means that although the processing is long, it is transparent. You know the exams, you know the requirements, and you know the timeline. So this makes it possible to plan step by step. Third, you do not have to choose between patient care and research. In fact, the best opportunities come when you can integrate both of them. Many of them, like most successful professionals I know, are those who practice clinically while also conducting research, publishing, influencing policies. And this dual role is very powerful and very respected. And the fourth thing is success does not only come from degrees, it comes from preparation, resilience, research exposure, strong communication skills in English. These are the qualities that differentiate candidates who succeed from those who give up. I have personally seen Pharm.D colleagues from India succeed in US, in hospitals, in research, and in industry. And I truly believe many of you sitting here today can do the same. The journey is not easy, but it is absolutely achievable with the right mindset and preparation. And I will just stop here and open the floor for questions. Feel free to ask me anything.
Dear participants, you can unmute yourselves and ask questions or raise hand so that we can unmute you one by one.
Mute.
Hello.
Hello.
Sir, very good morning to you.
Good morning.
Sir, I have to one question of my mind. Sir,
Yeah.
after the B.Pharm.C, which career is the best option to us?
Like it depends how you want to pursue. Like you want to go into research or you want to go on in the clinical pathway. So these days there are some visa issues, so people usually give their exams and they come here for degrees like MPH, which is Masters in Public Health. They come in pharma background. People come in Masters in Regulatory Affairs. They do Masters in Healthcare Administration as well. And they, and if you do a good application and you have strong letter of recommendations, you get scholarships as well. And
Okay.
the thing that I told you about, that you start writing research, like improve your English skills, all those things. And if you have a good resume when you come here for masters, you can get on-campus jobs as well, which like really helps you out, like money-wise. Like it will be very helpful if you have a good resume before applying here. But for farm background, I would say public health definitely, then healthcare administration and regulatory.
Okay, sir. Sir, I have the after B.Pharm.C research center is the best, but human researcher is the best for us. B.Pharm.C.
Human research?
Yes, sir. Human researcher means industrial pharmacy analytical department.
Yeah, so like if you have a, so I would suggest that you should also learn like analytical software, statistical software, like R and Stata and all these things before applying to those positions. And if you have a research experience with that, you can go into clinical trials and you can go to human-based research. And but for that in US, it's very different. You have to there are a lot of protocols. You have to take care of patient confidentiality, all those things. You should have a good grip on good clinical practices. And yes, you can go into human research as well.
Hmm. Okay, sir. Thank you for giving this kind of information to me.
Yeah, sure.
Yeah, we have one more query in the chat box. Hi, sir, I'm Roja from Pharm.D 5th year. So her question is, I heard that there is no pharmacy market in US. By the time we graduate, will the market develop?
No, it's not like that. Like a lot of my friends who were from pharmacy background, so after graduation, they joined jobs related to their masters. But while working there, They made connections over here. They talked to licensed pharmacists. They gave their exams, and now they're. I told you, like, you have to do your 1,500 hours of internship, and if you're a license, it literally depends on whether you're licensed or not. If you are a licensed pharmacist, then the market is still open. Like, it was never closed. Healthcare is a system which never falls, and we always need doctors, we always need nurses, and we always need pharmacists. It's just the process of becoming a licensed physician, licensed pharmacist is 2 to 3 years, and you have to be very well prepared. And once you get the license, then there are many, like, the market is open. You can do anything. You can open 10 pharmacies.
Yes, sir. I have one query related to this. So consider I prepared for FPG exam. I can give that exam in India itself, or I need to travel to US to give that exam.
Yeah, I am not sure about this, to be honest, but most of the licensing, the first steps you can usually give in India only. But there's some associated international fee, international examination fee associated with that.
Okay, sir, one more doubt. So after I clear my entrance exam, so I was eligible for performing internship. So now as a student, should I look out for internships in US, or the exam has a pathway where we can try to find who can offer internships?
It's usually on your own. You have to find it on your own. So that's why, that's what I told you. Like, a lot of people come here for masters, different masters, and then they make connections over here, and then they go for their internships. And with that internship, basically you are getting paid because you have a master's degree. You're basically working for them as well as you're getting paid, and you are completing your internship hours as well. But yeah, you have to find it on your own. Like, there's no pathway for that.
Okay, sir. So we have one more query. 1 second. So this is a third-year family student. So his question is, how does ambulatory care pharmacy differ from hospital pharmacy?
Okay, so basically in ambulatory pharmacy, pharmacists, earlier they used to give medicines only, but now I gave you the example. For example, in diabetes and everything, what they do is they take care of a patient. A patient comes to them, they can modify their doses, they can check their sugar levels, and they basically try to maintain the patient. But in hospital teams, there are doctors, nurses, and everyone, and they they are in a multidisciplinary team. In ambulatory, they basically work alone, but in hospital setting, they work with the whole team.
Okay, sir. So one more query. So it is from fourth-year family student. So he was asking, I have a strong background and interest in analytical work in chemistry. I'm really motivated to pursue research. But as we know, research has a very broad scope. I would like your guidance. Should I focus on research in pharmaceutical or analytical field, or I should move towards clinical research as a family student?
So it depends, to be honest, on your interests. Like, what are your interests? So either way is fine, to be honest, because they're working the work of the research industry is so big in US. Like, when I was in India, I wasn't aware of a lot of things. I didn't know that research can be on so many levels. So it basically, in the end, it depends on your interest. You can really go either way. It doesn't matter. As you have to love your work, to be honest. And if you love your work, you can go in either direction. You can go in human research, you can go in chemistry, you can go in analytical, and in US they are combining, these days they are combining everything as well. Like, there's AI now in healthcare. We have engineers working with us. So it's a mixture of everything. So I would suggest, just find what you love, and your foundation should be strong in the thing that you select.
I am audible
Thank
to,
you,
sir.
sir.
Yes.
Yes, sir.
Uh,
Please go ahead.
I have one question, sir. I am the Dr. Sachin Rohane and just a
Hello.
HOD of Pharm.D course.
Right.
Recently, we just started our first batch.
Yeah.
Is there any improvement in the government side or a precise side to uplift the Pharm.D profession in India, sir? Recently, we included in MPSC. That is, I can say the MPSC just regulate the eligibility for Pharm.D also for DI post.
Mhm. Uh, to be honest, I'm not aware much about India now. I have been in US for the last 3 years. So, like,
Okay, okay.
yeah. But while I worked
Sir,
as a medical officer back in 2022. At that time, like in my state, they were uplifting the pharmacists a lot, and they were given a lot of power. Like on sub centers, they were the pharmacists were handling the sub centers in my area, and we just used to go there and check. The thing with ambulatory care was being done in India as well at that point of time 3 years back. So I think definitely it would have improved by now.
Okay, they are the foreigner are easily accepting our Indians as a Pharm.D student
Yeah. So
or for a job.
yeah, so what they do is basically you have to complete your exams definitely, but like I would say coming directly to US, like finding an internship is very difficult, to be honest, because we don't have that. So the thing is, they want someone who knows the US rules and how US pharmacy system works. So for that, a lot of people come here for masters, and while like during those 2 years, they learn about stuff. They know how to navigate through the healthcare system, and they get the internships in. But yeah, once you get in, it's very easy.
Other than America, is there any other country which prefer Indians other than America? Maybe Arabs and all that.
Yeah, yeah. So Arabic countries, then also UK and
Hmm.
Canada and Australia. Yeah,
Okay, they are preferring most compared to
yeah,
America.
yeah.
Thank you,
Like
thank you so much,
Indians are
sir.
everywhere, to be honest.
Right, it's
Yeah.
right. Okay, thank you, sir. Thank you so much, sir.
Thank you.
yes, sir. We have one more query. This is from Lopa Mudra. So, hello, sir. I'm going to complete my Pharm.D in 4 months. I want a clarification. If I pursue residency from India, will it be applicable in US or I need to pursue from there itself?
You have
I think
to
this is
do
regarding
it
your
here.
EGY residency programs.
Yeah, you have to do it here again. Like if you even if you do it in India, then it will be a plus point for you when you apply for your residency because you have already done that, but you have to do it again here.
Yeah, thank you, sir. We have one more query. Myself, Sheikh Sumay, Pharm.D first year. So his query is, in the rapidly changing healthcare system of US, how can international Pharm.D graduates prepare themselves beyond just passing the FPGE exam to meet the professional, clinical, and cultural expectations of pharmacy practice in US? So he's asking how can he be ready as a student apart from exam?
Okay. So that's all those things that I spoke in my presentation. Like you should start building your CV very early. You should be well versed with uh, your pharmacy studies, your pharmacy experience, and your English speaking should be very good. All these things, like the whole seminar that I gave was about that. Only you have to be overall. You have to improve yourself overall, like so that when you talk to somebody, you are confident enough that they are not hiring you. Like you have the power to choose. Like I want to join you guys or not.
Yeah, regarding English, sir, I have a doubt. So for
Yes.
licensing exam, is TOEFL the mandate or IELTS accepted?
Uh, as far as I know, I think they take TOEFL IBT.
Okay, sir. One more query, I think similar to the previous query. Fourth year Pharm.D student, I want to ask, as a Pharm.D graduate, what key skills should we focus on developing if we aspire to work in clinical research or patient care abroad?
So you should focus on uh, writing different types of paper, like learn about different types of papers, know systematic reviews, hierarchy of studies. You should know about good clinical practices. Then there's a thing called HIPAA in US. You should know about that definitely, which is a big thing. Then basically you have to learn everything from scratch. Like if you are in a human research program, then you have to take permissions from higher authorities that you are going to pursue this clinical research. It is not harmful to the patients, and you will make sure that the patient data does not go out anywhere. So yeah, basically the best way to learn is to first read clinical papers and then try to write them. That way, with practice, you will get a hang of it. Once you understand the concept, it's very easy. You just have to make new ideas in your mind and just write the paper.
Thank you, sir. We have one more query. So this is from fourth year student. So he's asking, after completing the residency programs, PG Y1 or Y2 and board certifications, are the students allowed to involve in surgeries, like work as a surgeons in hospital?
No, you can't work as a surgeon. No. For that, there are programs called like there's a thing called physician assistant, and there is a thing called surgical assistant. If you do the surgical assistant course, then you can go into surgeries, but not as a licensed pharmacist.
Yeah. One more query, sir. So regarding residency programs, so can I know what additional skills or certifications should we start working on our Pharm.D course in India to improve our chance of entering PGY1 residency in US?
So these are like the basic certificates. You should go for BLS, ACLS, then good clinical practices. These are the mandate. Like you should have these certificates. And then that, like I said, if you start doing research and you go to conferences and you present, you get certifications over there as a presenter that are very helpful. It shows that you have the knowledge of methodologies and of research and everything. And then if you have like if you graduate and you immediately join some pharma company in India, or you work as a pharmacist, try to go join like good hospitals and get letter of recommendations from there. All these things make your application very powerful.
Yeah, thank you, sir. So one more student, she's asking approximate cost of the licensing process, entire things regarding exam fees, application, coaching, etc.
It really depends on person to person. Like some people, like I would say $10,000, 10,000 to 20,000. It may vary between 10,000 and $20,000. Like
Thank you,
I'm including the cost of coming here, doing your internship, 1,500 hours, living cost, all these things. But again, it depends on from state to state where you come, where you stay, how much is your rent, how much you're spending on food, whether you are working part-time or not, all those things. And for resources, how many resources you use, how many question banks you use. It literally varies from person to person.
Thank you. Sir, one more question. They're asking which specialization will be good for a Pharm.D graduate, whether it is infectious or oncology, pharmacogenomics,
Like
cardiology, etc.
again, it depends on your interest to where. Like it's your choice what you want to do. Like it's totally your interest. And I'm telling you, if you are pursuing something in US, be passionate about it, because when somebody takes your interview or something, they know whether you are doing it just for the interview or you are really passionate about it.
Sir, one more query from student. This is last question. Sorry to trouble you, sir. So
No, no, no.
actually, she is asking what is the importance of publications and clinical exposure during the student phase for securing global career opportunities in US and international exams, etc.
It is very important.
They need to
Very.
target some particular field like therapy or anything.
No, no, no,
Regarding
nothing like
publications,
that.
they need to target any field.
No, no, it's nothing like that. You have to like focus on only one thing. Even if you do 6 publications, one is in chemistry, one is cardiology, it doesn't matter. The basic funda is that one when you come here and they see your CV with the research publications, they know that you know stuff. So, for example, if I am an employer and I have to take a student in my research lab, I will hire somebody to help me out. So if you already have experience, I don't have to teach you anything. So I'll hire you first rather than hiring somebody who does not have any experience. So the earlier you start, the more experience you have, and the better are your chances in US, not even in US, like everywhere.
Thank you, sir. So I think with this, we'll close the Q&A session. And thank you so much, sir. We know it's late night for you there. Still, you
Yeah.
have waited for us to start the program and contributed. So we really
No,
thank you for that. Thank you so much.
No, thank you everyone for joining and thank you for inviting me. It was a great meeting.
Dr. Sanmit sir,
Yes.
this is Principal Dr. Manjappa.
Hello.
And thank you so much actually for accepting and joining us today, despite your busy
No.
schedule. And really, we are very fortunate, and our students are also very fortunate to, because whatever you share, these are, I think, need of the hour. They must aware of it.
Yes.
What before they deciding their future career. I think
Yes,
from management and
yes, we need, and like there's a shortage of healthcare professionals globally. We need everyone.
yes, yes. There is a simple tactic. The population is going to increase like anything.
Yes.
And
Yes.
with respect to that, I think health is at most priority. And of course, universe need healthcare professionals and more of Pharm.D also, as you said,
Yes.
actually.
Yes.
Yeah.
Like in rural areas, literally, like the rules are giving very much power to Pharm.D graduates and like the licensed physicians. They are basically the first people patients go to, and they can give you medications. You don't even have to go to the doctor because it's very costly here. So it's changing very rapidly. And like I would
Yes, yes.
say, this is the best time to move abroad and start when the things are changing. Because once everybody gets settled, then it will become harder.
Yeah. As you said, in US, these Pharm.D graduates can write prescription. I think that was a great, opportunity there. They
Yes.
can feel like doctors. But
Yeah,
India, I
yeah.
think still lot many things need to, change. I think as I said, no PCI is coming with syllabus where focusing on clinical pharmacy. I think
Yeah.
future of India, I think for Pharm.D graduates, it would be like US only.
Yes, yes, definitely. Thank you
Yeah,
so
yeah.
much for inviting me. It was a great.
Yeah. Thank you so much for joining us.
Thank you.
See you, sir. Yeah.
See you.
Thank you, sir, for sharing your valuable knowledge.